Hello everyone, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist here at Healius Cancer Clinic. So I'll use this opportunity to walk you all through parotid surgery. So how is it performed? What all you can expect? What are the complications? And how are these handled? So I'll talk to you all about this. In my previous videos, I have spoken about various parotid tumors. Most of them are benign and a few are malignant. Parotid surgery is one of the more commonly performed surgeries. So, how exactly is the surgery planned and done? I'll talk to you about mainly the surgical aspects here. So, the parotid gland is situated in front of the ear. It has two parts, a superficial part and a deep part. And the superficial part and the deep part are separated by the facial nerve. Facial nerve supplies all the muscles of the face, and any damage to this facial nerve leads to weakness of the muscles of the face. Now there are two branches of the facial nerve, one which supplies the upper portion of the face, especially the eyelid. So any damage to this portion leads to difficulty in closure of the eyelid. And the lower part, which mainly supplies the angle of the mouth. So any damage to the lower portion leads to deviation of the angle of the mouth. Now there are no special preparations required for parotid surgery. Usually we plan with the incision in front of the ear. Now this incision is, if made in a proper way, is not very evident, and once it heals well, it is quite difficult to make out that the surgery has been performed. Of course, it is important to place the incision in such a way that it is cosmetically good, because most of the parotid tumors happen in younger people, and a bad scar can lead to cosmetically bad results. So once the incision is made, the main challenge during surgery is to identify the facial nerve. Now the facial nerve identification is done in various ways. Sometimes we use magnification to see and identify the facial nerve clearly. Sometimes we use intraoperative nerve monitoring or nerve stimulator to see where exactly the facial nerve is located. So once the facial nerve is located, then we have to dissect above the facial nerve to do a superficial parotidectomy. Superficial parotidectomy is usually done for benign tumors and less aggressive cancerous tumors. Now, when we have to remove the deep lobe, we have to go beneath the facial nerve also. For this, we will have to retract the facial nerves gently and remove the deep lobe also. Now, apart from removal of the parotid, in case of malignant tumors, we have to remove the lymph node in the neck, a procedure we call as neck dissection. Now, what are the complications? Now, the main complications I told are damage to the facial nerve. Sometimes the nerve may be actually infiltrating the facial nerve, especially in case of malignant tumors. And in these cases, we may be forced to sacrifice the facial nerve. In these cases, if suitable, we do a nerve in reconstruction using another less important nerve and using it as a nerve graft. Apart from this main complication, other complications in parotid surgery are very less. Sometimes there may be collection of saliva which we may have to aspirate repeatedly. And sometimes there may be complications in the skin, like necrosis of the skin. When properly performed, the results are very good. Thank you.